The Commonwealth is reopening its economy with a phased approach called Healthy at Work. Based on guidance from the CDC and both health and industry experts, its goal is to protect everyone while getting the economy back on track. Organizations must comply with the current state requirement that all entities that are currently closed will remain closed until it is determined to be safe for their sector to begin reopening. Part of reopening and operating is mandatory training on protocols issued as minimum requirements across all industries, as well as industry-specific guidelines. Because we help organizations with their process management, project management, and organizational transformations, we wanted to help by providing this free training module to get you started and make the guidelines clearer. We've structured this easily digestible training so that, on completion, you will be able to understand the minimum requirements for all industries to reopen, organizations' responsibilities, individuals' responsibilities, and long-term impacts.
How do we know when it's time to get back to work?
Organizations that were closed must meet the following 14 minimum requirements before they can reopen, along with any industry-specific requirements found at, see the link below. If any entity in a sector being reopened cannot comply with these minimum requirements, they must wait to reopen until they are able to do so, or until some or all of these restrictions are lifted. All organizations that remained open, including those deemed life-sustaining, will be expected to meet the following minimum requirements no later than May 11th, 2020. Now we will review the 14 minimum requirements. Pay attention, as there will be a short quiz at the end. The first requirement is telework where possible. Working from home or distance working is here to stay. Operate via phone or internet to the greatest extent practicable. Entities are encouraged to implement a phased return to work, including generous telework, sick leave, and family leave policies for those employees who are not able to come into work due to illness, or taking care of family, or a lack of childcare. 50% or less in the office working at any given time, supplemented by distance workers, is recommended. Actual ratios should be tailored to your work environment. If the last few months have taught us anything, it's that many things we thought were not possible remotely are very possible. Organizations must ensure, to the greatest extent practicable, that employees who are not able to telework and must be physically present at the office remain a minimum of 6 feet away from all other employees and customers, unless closer interaction is absolutely required to perform their job duties, for example, a healthcare exam. Limit face-to-face interactions. Customer interactions and employee interactions should be conducted via telephone or internet wherever possible. Businesses are to ensure that employees, volunteers, and contractors wear a cloth mask. Surgical or N95 masks are not required. Gloves are also required for those touching common resources, that is, common to other employees or customers. Businesses shall provide personal protective equipment, or PPE, at no cost to employees and offer instructions on proper use. Encourage customers to wear a mask. Exceptions to this policy are, if wearing a mask would cause additional health issues, then exceptions and adjustments can be made to these policies. Also, when working alone at your workstation or in a closed office, there is no need to wear a mask. Adequate hand sanitizer and hand washing is also required and should be encouraged by all organizations.
How do we handle the common areas?
What's going to happen to those areas of our workplace that are designed to house groups of people? It's a natural question. Restrict common areas such as lobbies, waiting rooms, break rooms, smoking rooms, lunch rooms, or concession areas to maximize social distancing and reduce congregating. Anywhere that would normally invite people to gather is going to have to be reimagined to avoid unwanted proliferation of disease. Companies and organizations must also sanitize frequently touched surfaces and areas. For example, doorknobs, credit card machines, shared computer terminals, in accordance with the CDC guidelines. When they have identified an employee who has COVID-19 or the associated symptoms, entities must further ensure that they immediately restrict access to contaminated areas and post signage and adequately clean impacted areas. Any contaminated area should be off limits to all but the most essential personnel for a minimum of 24 hours if practicable. How do I know if somebody is sick? This is most likely a very prevalent concern, but the guidelines that have been crafted take this concern into account as well, with the following guidance. Entities must require employees to undergo daily temperature and health checks. More details about these checks and how to perform the steps required to follow. These checks may be either self-administered or administered by the entities prior to workplace entry. Self-administered temperature and health checks may be performed at home. However, employees who have a fever and/or any symptoms of COVID-19 should be directed to their healthcare provider to be tested and then instructed to quarantine at home as soon as any illness is detected. This includes employees that passed a temperature and health check prior to reporting to work that became ill during the course of the day. Companies like Amazon Business have opened a COVID-19 supply store specifically to give businesses a place to shop for this precise equipment. More details to follow. Each company and organization must ensure that an employee is designated as a Healthy at Work officer. This individual will be responsible for the entity's compliance with this guidance and any other guidance provided. Companies and organizations should allow for employees to identify and communicate potential improvements and/or concerns to the Healthy at Work designated officer or management.
I have vulnerable employees. What consideration should I take for them?
We must make special accommodations. Companies and organizations must, to the greatest extent practicable, make special accommodations for employees or customers at higher risk of severe illness. Individuals in these high-risk categories have been identified by the Centers for Disease Control and Prevention, and for a complete list of those groups, how to identify those individuals, please visit the following address. How do we handle non-compliance? Within every group, every organization, and every company, there may be those individuals who are having difficulty or unwilling to follow the prescribed guidance to work safely together. When these instances occur, feel confident to approach your Healthy at Work officer and report your concerns freely. These concerns will be taken seriously, recorded, and reported up the chain to the organizations looking after the response for the entire state. The official documentation from the state offers this warning. Concerns not taken seriously can be very serious for your company or organization. Let's take a closer look at what the company or organization needs to do to get back to work. Companies must provide PPE or personal protective equipment, including masks and possibly gloves, to all employees without cost to the individuals. For a complete list, follow the link provided. Temperature screenings and health screenings must be provided. Taking part is not optional. Let's take a deeper dive into the issue of screening. Normally managed by your Healthy at Work safety officer, temperature screenings involve each individual checking their temperature at home before they leave to come to work. If the temperature is at or above 100.4 degrees, that is the threshold at which concern must be taken and workplace should be avoided. Many offices will also opt to screen everyone entering their physical office one at a time outside of their office before you enter the doors. That check can be done with a no-touch thermometer device as to provide the most safety, and all screenings have the same threshold of 100.4 degrees. Maintain social distancing while lining up for this check. This check is required every single day. If you discover a fever, do not report to work. Do report your fever to the Healthy at Work officer. Allow them to look back at the activity that you've taken in the last 24 to 48 hours so that they can head off future problems. Health screenings are a checklist or written record of your health over time. Your Healthy at Work safety officer will be gathering this data in a manageable, traceable method. Probably using online surveys and mobile devices would be most efficient. Again, Celerity can help you set up a program that works for your organization. Questions will include details about your specific symptoms and any contacts that you've made within the last 48 hours if you are experiencing any symptoms. Businesses can manage health screenings by having employees submit the results on their own or having a survey issued in the workplace. Acting on the screening results means creating a testing plan and having employees with symptoms tested within 36 hours of discovering a symptom. Training must be provided on isolation and reporting of cases, and again, Celerity is here to help. Notifying of the local public health department is mandatory. For more information, follow the link provided to the CDC website to discover what to do if you are sick and the steps to take. Individually, we need to wear masks and, when appropriate, gloves. Using proper PPE and practicing social distancing is the most important thing that we can do right now to slow and stop the spread as we return to some normalcy. Remain vigilant about your health checks. Take your temperature at home. Keep a log. Report the results, and check your breathing. A simple recommended test involves taking a deep breath and holding it for 10 seconds. If you can complete this exercise without coughing, you likely do not have chest congestion that is of concern. Long term, what can we expect for the foreseeable future? Experts have set expectations that this specific illness and related illnesses that may appear are going to be with us for the foreseeable future. Effective treatments are going to come at an unknown pace. Being more conscious of our surroundings, who we interact with, and tracing contacts will become a way of life for years to come. Requirements outlined here will be relaxed over time, but some of these measures will stay with us indefinitely. Be prepared to stay in touch with your health, listen to your body, and communicate concerns effectively without a fear of reciprocity.
What if I have more questions?
Celerity has additional materials that can be found at the Celerity website. Specific guidance for Healthy at Work officers, their responsibilities and materials to perform their duties in their offices. Procedural guides for temperature screenings, health screenings, and reporting, all the standards, the processes, and the obligations around reporting procedures. Sources for this module were taken from the Centers for Disease Control website, public health officials' website for the state of Kentucky, and from experts within the industry who have been planning to reopen after the quarantine. Next, you will take a short quiz to confirm that you understand the key concepts and have confirmation this training was provided. We hope this training was helpful. If you would like a version customized to your industry or your organization, please reach out to us at info@celerity.com or visit celerity.com/contact.